Hi, I'm a registered veterinary technician with Blue Pearl Veterinary Partners, and today I'm going to go over urinary catheter care. If your pet is sent home with a urinary catheter, it's most often a Foley urinary catheter, which means that it has a balloon that sits just inside the bladder where the bladder narrows to the urethra. The urinary catheter then exits the pet and comes down into this urinary collection system. This collection system is passive, which means that it needs to be at least a couple inches lower than your pet's bladder in order for it to flow. It is also important that where the line exits the crate, it can freely move back and forth to ensure that it's not occluded. When you empty it, it has a lock system. You unscrew to the left, empty it into whatever bowl or container. Once empty, close it to the right and then make sure that it's tight, otherwise it will leak. When you're emptying it, it's important that you wear gloves and wash hands after. Your pet should produce 1 to 2 milliliters of urine per pound per hour. This is a rough estimate. Generally, as long as they're producing urine, we are happy. It's also important to make sure that water is freely available. If after 4 to 8 hours you realize that your pet has not produced any urine, I'm going to show you how to flush the urinary catheter. The reason that we flush it is in case we have a blood clot. This is normal. Because of the anatomy, this balloon may rub and irritate the bladder lining, which would cause a small bleed and a clot to then go down the line. These are generally normal. However, if it does become occluded because of a clot, we use a sterile saline flush. These needles are only on for sterility purpose. You unscrew the needle and then you push the syringe in and turn to the right. This will secure it onto the urinary line and is called a lower lock system. We are going to be using this syringe twice for flushing. The first time it's used, we occlude the line towards the bag. We then pulse the syringe into the pet. So you will be putting sterile saline into the bladder. Then we pull back to ensure that it flows freely. The second time, we'll be occluding towards the pet. We then flush down into the urinary collection system. The reason for the two-directional flush is to loosen any blood clots in the urinary catheter on both sides. Blood clots like to collect at all of the junctions, and so it is important to also dislodge the clots down here. If your pet removes the urinary catheter, it's important that you bring your pet into a veterinarian as soon as possible. Bring your pet and all parts of the urinary collection system that you can find. To prevent your pet from chewing it out, it's important that they wear an e-collar or have some sort of preventative method to keep them from chewing. If you have any questions at all, feel free to go to your nearest veterinarian, emergency or non-emergency, or call anytime. Thank you.